Wonder if we can share it to our page.
Okay, and I think we might be live. Let's just check a little bit before we start chit-chatting.
I can see it.
I've just shared it.
Amazing. Hello, everyone, and welcome to our live with ABIC, and I've got QANU sitting right here in front of me. And QANU, of course, stands for Queensland Aesthetic Nurses United. So welcome, Lisa, Ree, and Megan. How are you all today?
Thank you.
Good, thank you.
Well, that's good. I'm glad you're okay and ready for a huge, lengthy, very meaty, and extremely probably raw discussion today that we're going to be having about um, the tumultuous and extremely sometimes heartbreaking and sometimes what seems to be not exactly the fairest situation of all. And that is the Queensland health legislation that has just come out. And in the midst of so much turmoil in our industry has actually gone through so much media scrutiny over the past maybe 12 to 24 months, intensifying recently with so many media articles coming out, showing or skewing, I suppose, our industry in an interesting and probably not so favorable light. And amongst this, what's happened is actually regulatory bodies have looked at this media attention and all this hoo-ha that's happening and have started to look more closely at our regulation and legislation. I know this because whenever I go into regulatory meetings or government meetings, the first thing they ask me is, who do you represent? And of course, we as ABIC represent the united beauty and aesthetic industry, and that's every sector from medical aesthetic to dermal and beauty in a united way. And the reason we do this is because we primarily represent small businesses, right? So we are small business advocates as ABIC, and to do that, we look after the umbrella of the industry in a small business sense, but also employees. And then we advocate for legislation as well, with, of course, partnering with the other associations that specialize in each niche. So we're a little bit of a different type of organization. We have a lot of pull with government because of our small business and legislative work in that arena. So when I go in there and ask, why are we here? Why are we talking? Why have I been called to speak about legislative changes for regulation? They say to me point blank, it is the media attention that you're getting. So in the midst of all of that, we've had a huge spotlight put on Queensland, because Queensland have had legislation that is questionable and interpreted now in a different way than the nurses were and the industry was aware. In short, we're here to discuss the challenges, the problems that we're seeing as a result of this interpretation of legislation in Queensland, and to hear from this incredible group of women who are fighting for fairness in Queensland. And I would like to hand over to QANU now to introduce yourselves as well. Tell us a little bit about all of you and how you came to be together.
So I'm Megan, Megan McRae. I've been nursing over 30 years, in aesthetics 15 years. So I am passionate about the industry and have, helped a lot of nurses and doctors and beauticians along the way with the clinical training side of things. We came together as a collective in April, so not that long ago, when we realised that we really didn't have a voice in Queensland. We were told that industry was being consulted, but no one was actually talking to the Queensland nurses on the ground, the nurse-led clinics. So put out a call to some colleagues. We met for a coffee, and here we are.
Wow. That's just wonderful. Can I really because I've spoken to you both, all of you, so many times, I understand what you're trying to achieve as QANU, and I'm skipping down a couple of questions, but I thought it was pertinent to introduce you all first. You know, what are the core values and goals of QANU? Why did you come together? What are you fighting for?
So I think we were really lucky when we first got together in our first meeting, is that we had different nurses from all different scripting companies. And I think the biggest thing we knew was that everyone was being told different things by their scripting companies. And we were like, well, what's true? What isn't true? No one's actually answering anything to us. And for us, it's our businesses that are on the line when it comes to what is actually compliant in the eyes of Queensland Health. So you had, one company saying, oh, that model is not going to be compliant, you have to do this. And we were just so confused, and we're like, why aren't we able to ask those questions directly to Queensland Health? And then we were just like, no one's answering. No one will talk to us. Most of us had written letters to our local MPs and getting nothing in return. It was almost like they just ignored us. So we were really fortunate that when I reached out to Megan and said, let's have coffee, because it was literally a message in a WhatsApp that was in one of our groups. And I think we just felt like we just wanted to chat, because I have a small business where it's just me. Megan's she has other people. Ree's in her own business as well. Most of us were all just single business owners, and you have nobody to chat to when you're alone in your clinic. And that was the hardest part, is not being able to talk this through with anybody. So when I reached out, Megan was smart enough to actually bring the union along. So we were really fortunate that NPAQ came along. He was really responsive to Megan and said, look, I'll come and have a coffee with you. And he said to us, why aren't you guys fighting? Why aren't you doing this for yourselves? Because we thought that other people would stand up. We do have other associations. We thought they would stand and fight for us. We thought that the union may have known about it, but they had no idea. And it just felt like nobody was fighting for us, when it's really our businesses. It was our turn to do it for ourselves. So he said, if you can get us numbers, we can help you fight. And he said, get us 100 in a week and come back to me. And so we got, what did we get? 150 in 24 hours. And I'm like, we're ready to go. Let's do this. We just want answers. We want to be recognized for the nurses that we are and the business owners that we are. And we want a seat at the table, because we just haven't got one.
I love that story. It's beautiful. And I think that's how we, ABIC, us and QANU, kind of connected, because at the same time, we did a survey. So ABIC did a survey and case studies and put up, an advocacy paper and so forth, and said, look, we're meeting with Queensland Health. And then Megan, you saw that, and then you were doing a survey. So we then went, oh, we should join forces. Yeah, which was really, was actually fortunate, because right now, because of our combined efforts, we are getting some traction happening, and I think that's beautiful. So what has actually specifically changed in Queensland Health's interpretation of the legislation? Who wants to take that one?
So the change has really come about from the way that we can order and store our medications. We're now not able to do that as registered nurses, and we're either going to need to have our medications ordered through a pharmacy after the prescription's been done, or we're going to have to employ doctors to work out of our clinics.
Right. So what you were doing previously is a question. Were nurse-led clinics prior to this, what the system they were using, was it considered lawful practice in Queensland Health's eyes?
We were under the impression that it was, I suppose. Had the question been asked by all of us as individual nurses, possibly not. But our scripting companies, we assumed, would have gone down that alley, and it should be. But then again, I think about what I do in a hospital and how I manage S4 medications in my ward, and it's no different to really what we do now. I order them, we receive them, and we store them, all without a doctor even knowing what we're doing. So that's just...
So that's the contentious part of it, right? Now, I met with Queensland Health some time ago, and I asked them that very question. I said, is what they've been doing lawful, nurses practicing, they said, well, no, it was against the legislation. To which I came back then, how come you have actually told and directed nurses over the past 2 years that they were acting, in fact, lawfully? Because we have many instances where there's been written advice, even from Queensland Health, that assigning a responsible nurse was the right thing to do. So the model had been tested and approved by Queensland Health until recently, when the enforcement of it and the interpretation of it became live. So previous to that, they even thought that you were operating lawfully because of the advice that they'd given. So that's what the conundrum is, because in every single other instance, apart from cosmetic nursing now, a nurse has been trained, has gone to university, has done all of her study, has her training on the job to manage stock. That's literally what they do. Doctors don't do that. So why is it, our question was, why is it that, now all of a sudden in the cosmetic field, that same practice that you do in hospitals and in medical clinics and in immunization and in every other sector of the industry is now not okay in cosmetic nursing?
Feels a bit strange when you actually dig deep into the legislation. I've been over it and over it many times. It is actually, the registered nurse is able to do this, this, and this. So why is it that we're not allowed to do it in our clinic? So it does feel very targeted towards our industry. And that would obviously be a question we would love to ask if we ever got a seat at the table.
I feel, sorry, I feel undermined by the legal ambiguity of the fact sheets, and the fact that the scripting companies were with all their lawyers looking at the individual pathways offered and still scrambling to come up with definitions of what is compliant.
I actually asked the same question. Do you, in terms of the interpretation of this legislation, I asked several questions on, what is actually considered okay. Is this scenario considered okay? For example, that a doctor comes in once a week to receive or to order the stock or to write some scripts, and then off they go, and then the nurse is looking after the stock. Is that okay? Oh, we can't be prescriptive. So the answer was, we don't really know. We can't really tell you how long a doctor needs to be in the clinic. We can't be prescriptive about, what system you use to manage that stock. So there was a lot of ambiguity, I believe, on their part as well. And I do believe the fact sheet was extremely rushed and not considered. Like, for example, the pharmacy model that was prescribed was not considered. We'll talk a little bit about that later on as well. Do you see this? Because people are questioning, is this a legislative change or is it an interpretation change?
They're saying nothing's changed.
I think it's interpretation, well and truly. Interpretation for our industry alone. But that's my opinion. When I look at the other nurses who have abilities to do things in other areas, and I think, why can't we?
Can I ask a question? Was this introduced with consultation?
Oh,
any notice?
Not that we're aware of.
I mean, we're a pretty big group now. Like, we have quite a big group online, and we would obviously love more. If anyone wants to come along, you're a registered nurse in Queensland who does this, we would love you to join our group on Facebook. But it is, when we got at our table, we were quite vocal. Nobody had been able to ask these questions themselves, and no one had been asked by Queensland Health. So it was not that they were consulting with people on the ground.
And I can tell you, absolutely, we weren't consulted. Government bodies and regulatory bodies do reach out to ABIC quite often. I get calls to sit on panels, committees, give advice, talk to them about the possibilities. They raise consultation, they raise submissions. There is this, in this case, it was quite silent. even APRA in 2023, 2024 raised the consultation before these guidelines when it came out this week. They raised a consultation about it. Did they listen to our feedback? Probably not so much, but at least they raised the consultation, and they gave us an opportunity to write quite lengthy submissions. And when I read the guidelines, actually they were quite considered, and they did consider a lot of the feedback that we had. In this case, there's lots of parts of this particular interpretation that weren't considered and were actually potentially dangerous to patients. One of those is the pharmacy model, which opens up a can of worms on safety of potentially the client grabbing their own prescription and self-injecting, or encouraging black market, and we'll talk about that a little bit later on as well. But tell me, what is the immediate impact this has actually had on your clinic operations, your stock holding, the patient services? Are you still operating? Can you still operate? What's actually happening to you on the ground?
So I think everyone's different, but personally, my clinic, I've had to cease actually injecting S4 medicines. And that's after a conversation with my insurer, who told me that I was no longer insured, basically. So that ended it for me.
And quite a while ago, that was like 2 weeks ago, right? So you've not been on,
Yeah, 2 to 3 weeks ago.
yeah. So that's
Yep. So just
3
in
weeks.
limbo now, waiting for the scripting companies to sort of get the back end stuff done so we are compliant.
And this could take another 2 weeks. So that's like 5 weeks, no business. So that's a scary thought.
It is when you've got leases and mortgages on your business as a business owner, and not much coming in.
It's more than scary. It's devastating. I know, because, I've been in business for the last 20 years. Especially in our industry, and I'm talking to all the business owners out there, they'll know just like you do. I mean, it's not like we've got hundreds of thousands in the coffers. If you don't make your takings or you hit your goals, that month, you're behind. That's just not hitting goals that month, right?
Mm-hmm.
And then if you're behind for 3 months, you're like, okay, where do I get the money to pay my taxes now? Or where do I get the money to pay my staff or myself? And then you're having to scrimp and save. If you're out of business, you don't have income at all. Who's paying the rent? Who's paying the expenses? Who's going to cover all of that? And it's not like we've got hundreds of thousands, as I said, in the bank, just waiting there for a rainy day. It can be really devastating, not just to the business, but to your family as well. Have you heard stories? Because I've heard stories across Queensland of just devastation. What's happening out there as well?
Businesses are closing. We've got stock in cupboards that, what do you do with it? What do you do with thousands of dollars worth of S4 stock that's locked away right now? That's a big question. And there is a rumor going around. I haven't seen it in writing, but that this is going to be enforced from the 1st of July. So it's not a lot of time to move that stock, if you can move it at all. So, what happens? We've heard from members where they've stopped practicing as well, decided to close their doors. So I know of at least 15 clinics in our group who have paused or are closing. So it's pretty devastating.
What's the sentiment?
It's also emotional, right? Like,
Right, I was going to say.
we have just, like, for us, the messages start at 6:30 in the morning and they go till almost 11 at night. People wanting things, people reaching out, but also what's happening in the media. Like, what are we doing these things later? Like, it is just mentally exhausting the last few days. But then on top of that, you're like, I still want my business to make enough to pay my rent for this week. And you're trying to do things. I myself I haven't heard personally from my insurance company, but I know that I don't also want to risk anything. So I haven't been doing high risk. I haven't done any fillers for the last few weeks. And most of my patients are patients that I would treat for anti-wrinkle and know how they react to it. So I reduce my risk, but without those, my clinic can't survive on skin services alone. So it is the choice that I've taken. But it's also risky, right? And we just, honestly, when we all met, we had hoped that our scripting companies would have their act together and would have something. But even since then, that's been 4 weeks since we all met, and they still don't have it. And we're still looking at weeks ahead. So this is a long process, and I understand it takes a while, but at the same time, this is a while without business, and it's interesting.
It is devastating. Sorry, Megan.
No, it's getting real. It's really, it's hitting us hard.
What are your biggest fears if nothing changes?
The black market situation, because the need versus supply is going to be there. People still want their services, so the prices are going to be driven up with the new models that have been offered. So the doctor pathway is going to cost my clinic. The pharmacy pathway is going to cost me more, considerably more per patient, per script, per delivery. So therefore, I have to pass those costs on to my patients. So, demand and supply. Are there enough doctor services out there currently? I don't know. Are rural clinics underrepresented and having to close? Yes, absolutely.
Wow.
Unfortunately, we are already seeing black market side of things now. What do we think it's going to be like when all the prices are driven up and it's just not accessible anymore?
I feel like also there's a deeper issue here that, I've heard this comment, why are the nurses upset? Why are people upset? They can still operate. We're not saying you can't inject. Queensland Health have said that. Many other people, I suppose, that don't really understand profoundly the situation as it stands, have said, what's the problem? We don't actually understand why they're upset. They can still operate. They can still be scripted. They can still administer. They can still do those things.
So
why they're upset? Sorry, go ahead, Lisa.
Number one, the cost of it. Each model is expensive, right? And we understand that. We understand, if we have to hire a doctor, that we're talking minimum $850 a month. All right. So that's a big cost to a small business. I don't see a lot of patients. I also don't bring in a huge gross profit. So $850 does mean I have to increase my prices significantly. But everyone's saying, the pharmacy model is going to be a great one. But most of them are looking at $25 per patient extra just for the dispensing fee. And even in a small clinic, I think I've used the number of 15 patients a week, you're looking at that's minimum over $1,000 a month. So that itself is more expensive than the doctor's model. So I think we all freaked out when the doctor's model was put forward that it was going to be so expensive. But the pharmacy model itself is just looking financially unviable altogether. Plus, they're talking about an increase in the price of the product itself. Then they've also got the fact that they want to pre-draw up syringes with units in a vial that I've never seen the vial. Don't even get me started on injecting someone in the face with something that I've never seen the vial of, and I have no idea what it is. So that's scary in itself. So I think financially it's number one, but also it's a bit of a hit to our professional. I'm a registered nurse. I have been for 18 years. I have to hire a doctor who's maybe been out of university a few years just to come and look at my drug cupboard. And that's just offensive, I feel. Like, we are registered nurses. We've been at university. A lot of us have postgraduate qualifications. And here I am having to hire a doctor. And when you speak to, I have so many patients of mine who are doctors. And I actually saw one today, and I said, you come to a nurse to have injections? And they said, I would trust a nurse more than a doctor for something like this. And I think, well, that's actually beautiful. Thank you. But it's true, right? Like, in the hospital, most of the patients come to a nurse when they actually need something. And when they have just a question, they go to the doctor. So That's my opinion.
Absolutely. Oh my gosh, I love the passion that you speak with is just so inspirational, all of you. When I hear you speaking, I really understand the situation even more. I mean, a lot from a legislative perspective, I understand the situation back to front because I've studied the legislation, I've written a submission, which is quite lengthy. I think it ends up being between 25 and 50 pages for our ministers to read through and get through to provide solutions. But the part that I, from as ABIC, don't understand is that there is actual legislative confusion. It is not clear. The actual legislation and the interpretation doesn't give confidence to pursuing one or the other model, and it doesn't give a definite answer. So when you're posed with situations whereby the insurance company gets involved, you don't exactly know what it is that you should be doing. We know in theory a doctor should be present, but we don't know how long he needs to be in your clinic for. We know that you can't dispense, but what does dispense mean? Because last time I spoke to Queensland Health, and I believe another association did as well, I think CNA is doing some great work there to find answers as well. The answer was, well, dispensing means handing to the client or the patient, whereas administering is something different. A doctor can prescribe, you can administer, which means the nurse can administer, which means you can go into the cupboard to administer, but you can't then dispense, as in give it to the patient. My question was, well, we never did in the first place. So what is that about? What are you trying to stop us from handing the medication over to the client? And what does all of this mean when something goes wrong? Will the insurance company interpret what you're doing as within the legislation? Because that's questionable too. So the problem is you don't want to start treating, because if you do, it's not a matter of Queensland Health coming in and going, oh yes, you're operating correctly or not. It's a matter of, if something goes wrong, will the insurance company help you? Because you're left in this grey water area where you haven't had a sign off from Queensland Health. You are trying to interpret to the best of your ability, but you don't actually know if you're lawful or acting lawfully or not, because it's so murky. And that is the reality. If you're listening out there, this is a true reality. There's a legislative hole and grey area there where we don't know really if we're going to be looked after by insurance, or if when Queensland Health comes to visit, we think we're doing the right thing because, okay, we've got a doctor. We don't know how long, but he's coming in once or twice a week. Is that enough? So we don't actually know if we're doing the right thing. Is that scary or what?
Very
It's really scary.
We have a duty of care and a scope of practice. We're professional nurses. We want to be compliant. Just give us a pathway that's economically viable, like the poisons license, like our counterparts have in Victoria and Western Australia. It makes sense on a national scale to be consistent and uniform.
I love that you mentioned that, because that leads me to the another part of what we're talking about is, let's start talking about solutions now. We've told everybody there is a problem. It's okay. They've come up, the nurses can practice. I'm not sure what the big deal is. We've told you what the big deal is. Insurance is the be all and end all in any business. If you cannot be insured, you should not be operating. It should be completely banned, honestly, in Australia or anywhere to practice without insurance, because that can actually really impact you personally. And if something were to go wrong, you could be personally liable for whatever repayments or whatever payouts you need to provide. So what's the solution? So ABIC have been working on this, and we've joined forces. When you were talking, Lisa, that messages go back and forth each day. We all four message each other consistently, and we've come up with some solutions and a pathway forward. So under ABIC, we have 4 different sectors. So we have the medical aesthetic sector, dermal sector, beauty services, wellness and spa sector. So we encompass the whole kind of industry. And we also have other sectors like emerging technologies and a menopause aesthetics sector that's about to, and a division that's about to be launched, electrology and so forth. Underneath these sectors, we actually have divisions whereby the structure allows a committee formation. So the committee formation underneath the sector is a legally standing structure within ABIC. It is fully insured under ABIC. It falls under the ABIC remit. So we're a not-for-profit organisation. I'm not here to make money, neither is the council or any of the committees that volunteer their time. We're here just to genuinely help. But the organisation runs as a not-for-profit entity with all of the, binding legislation and binding parameters that we have. So that committee, that whatever committees that are formed under those sectors are actually fully protected, and we're able to create working groups under those sectors as well and under those committees. So what we've done is we've established a Queensland aesthetic nurses working group, and this working group is run by ABIC. So any nurse that is in Queensland, any legal practitioner, so if you're an educator, you're a legal person, you're a lobbyist, a person that is a doctor, a person that is passionate, that wants to help the Queensland nurses. It could even be suppliers. We need suppliers. We need people from scripting companies. We need all types of people that want to fight this. We would urge you to join this working group that we formed. So the working group has representatives of QANU on it, right? So we actually have all three of these wonderful ladies on this working group. And with this working group, when we're formed, we'll actually let everybody know when we're actually taking applications for this working group, which is going to be pretty much the beginning of next week. We will vote and decide who's going to have leadership positions in that working group, and then we're going to discuss a plan and our remit. What is it that we want to achieve? And then we're going to go and use all of the ABIC resources that we have available to us, all of the resources that our stakeholders bring, QANU brings, and so forth, to actually structure a well thought out and planned strategy to combat this, or to at least get better and fairer, more clearer interpretation, so that our Queensland nurses are not sitting there scared, worried, and not able to operate. So we have discussed so many ways forward, and I am personally in Victoria. And in Victoria, I've run my clinics for 20 years under a poisons permit. And in Victoria, it's a very smart way that they've done it. There's a responsible person. The responsible person is an RN. She's under a doctor. The doctor does their scripting. The responsible person looks after the receiving, management, and administration of stock. They look after it with an S4 log. They're very precise. They have a poisons control plan. They have an action plan. It's actually such a really great, well thought out system that doesn't actually create a lot of burden. We're actually going for the ultimate is going for legislative change. So that is a huge endeavour that requires funding. So if you're out there listening, QANU and the Queensland nurses, they need funding. We need funding to get a lawyer to actually, because they're not cheap. We need lawyers, lobbyists, a lot of funding to be able to, do the campaign and so forth, to be able to get legislative change. And this is not just a spotlight on Queensland, right? It is an opportunity to say, we love safety. We want to be safe. We want to be compliant. We want everything that you all want, regulatory bodies, but we want clarity, and we want the understanding of the right parameters, and we want fairness and justice. And this is an eyes on us situation, eyes on Queensland situation, in two ways. One, New South Wales will come next, because their legislation is very similar. So if we are able to do this for Queensland, this is setting a precedent for the future. And it's also protecting other states that now have the ability to have a poisons permit, or to have their nurses safely treat and operate and manage stock. It's protecting them for the future as well. And the second thing that it does is it shows that we're not going to just sit here and say yes to everything. We deserve to be consulted. We are not going to go quietly and say yes to everything that's put forward, because we do have voices and we're professional people, and we would like to have a fair and a great exchange and a consultative process. We're not being combative. We just want to be consultative. We want to participate in decision making. We want to share our knowledge and what we know is best practice and what is safe for our patients. We want to be able to share that with the regulatory bodies so that we can truly protect our patients, because that's what we want. So we're very excited about this working group. It is a way forward. It is a wonderful exercise to do, because it'll show the world and the industry, everybody who's looking, because don't forget, you've also got the global aesthetics, looking at us. We're looking at Britain, they're looking at us. I'm talking to America, I even spoke to South Africa, who are going through similar things. We're all watching each other and we're all sharing ideas, actually, and challenges. So it's not just for Australia, it's for everybody, and to push the agenda of sort of freedom of choice as well, in a more succinct way. So tell us a little bit about, I suppose, what your hopes are through the working group, and how you see this collaboration going between ABIC and QANU as well. Lisa, did you want to take that one?
I said to you earlier before we even started that I feel very fortunate that when we first started, we're very grassroots and we had a lot of passion, but we didn't actually have I suppose the foundations and the backbone and the understanding. We wanted to be able to, organize money and funds, but to do that you have to be a registered organization, and that was going to take us a lot of time. I've worked for not-for-profits before. It is a lot of effort to get one started, but also we didn't need it like this is a long-term goal, but we also didn't need it forever. So once you start one of those things, you have to keep it going. So for us, it was more like we want to fight, and we want to fight till we beat it, and then we can dissolve it. So when we met you, but it just felt silly because we were also doing the same thing. So why two people do the same, well, two organizations do the same thing and not join together with forces? So, and that's why we always ask other organizations that we find doing the same thing, come and join us, because we are stronger in numbers, and the more that we have, the better we look to the government. So when we found you, it was just a blessing, and we're very lucky. And you already had a lot of the stuff that we were wanting to do, and then we were already doing things that you were sort of doing, but we had large numbers. So we were just really lucky, I think. I can't even describe it better than that. But I suppose what we now want to do, and what I say to nurses all the time, we're very lucky the scripting companies are coming on board, and hopefully it'll be in place soon, but that's not the end. That's not our end game. Our end game is change, because we can become compliant according to scripting companies and work with them, but that's not a long-term goal. Our long-term goal is, like you say, legislation change, and that's going to take a while, even while we're compliant. We're not going to stop. We're not going to sit back and say this is okay. We're going to keep going, and we want change because we want to be recognised for who we are and what we do.
I love that. There's a deeper issue as well here. Whilst we've been talking, I've been thinking about how our industry is made up and what it's comprised of. And, there's statistics out there saying, oh, there's 95% females, led businesses and females in this industry. It's actually more like 98 to 99% female led. We're talking about, the beauty, dermal, cosmetic nursing side of the medical sector. Obviously, we've got our wonderful cosmetic doctors who are a mix of male and female, but we're looking at high 90s. What is the gendered economic and equity issue that you feel is presented right here when it comes to nurses and nurse-led clinics?
Yes, I want to say witch hunt, but I'm going to rein myself in on that one.
Oh, you just said it, so
You can say it.
Did I say that out loud? I did. There's a lot of single mothers in the group. There are a lot of women supporting their families and being the major breadwinner. That impact of businesses closing is devastating, absolutely devastating. It's that knock-on effect for not being able to pay the school fees, or not being able to pay the medical bills.
I want to add to that because I have small children, and I started this purely because my husband and I were both shift workers. And how on earth do you run 2 children through school as shift workers? And you just, plus I worked in palliative care, and it just broke my heart every day after 16 years. It literally broke my heart when I would see mums my age and children in the room that were my kids' age. And I'd done it for years and it never affected me. And then it just did. It just came to a point. Anyway, but now I literally get to drop my kids at school every single day as a registered nurse on a ward. That is not something that we ever have the luxury of doing.
No.
You know, being at work, my hospitals, and I still work in the hospital. I still work in the hospital, so I do both. Our ward starts at 6:30. Osh care doesn't even open till 7. So you can't even get your kids. Even when I'd get to daycare, I was always at work late, and I'd have to just get a handover on a piece of paper. You know, just being able to drop my kids at school, come to my clinic, do my shift, go and do reading at school when I can, because they want to see your face in the room. That's not something a registered nurse ever has the opportunity to do. And when you look at career progression in the hospitals, it's just non-existent right now. You know, people aren't retiring, people aren't moving on. So you don't get to be in higher positions if you ever want to be, but you also just don't get the life, what is it called? The work-life balance. Like everyone talks about work-life balance, and that's all great for people who have 9-to-5 office jobs. But when you're a shift worker and you have a husband who's a shift worker, you never get time with your family. I now get to close my clinic on a Saturday morning to go and do sports, then open in the afternoon, because it means that I get to see my patients then.
Oh wow,
there's nothing in this industry as a registered nurse that would give me that opportunity.
Rhea, I see you nodding. You're in the same situation.
100% agree with that. You know, we can still be there to put our kids to bed at night. We can show up for all the events at kindy, at school. Like, we can still be present as parents and do our jobs as registered nurses.
That's beautiful. I mean, there's so much benefit in this industry, for not just for the patients. We know what the benefit is for the patients. We inherently know. I suppose the media is struggling with what is and what isn't, you know, reality there. As a matter of fact, I spoke to someone in the media today, and they told me, oh, the reason that you're seeing so many skewed perspectives is because TGA don't appreciate positive articles in the media, because they interpret that as advertising for what we do, and we shouldn't be advertising or putting it in a positive light, because it's a medical treatment. So in actual fact, a lot of the times I feel like some media have to choose the negative slant to actually get some readers happening, because the feel-good stories of our industry probably don't sell, and they probably don't they're probably not liked by regulatory bodies. So that's an interesting perspective as well. So
interesting you say that today, Steph, because we actually met with ABC and they filmed Megan, and we had Courier Mail today. We've been busy, but the photographer for ABC, he's like, you know, when I heard about this, he said, it's crazy. He said, my wife gets it for migraines.
Yeah.
And he said, I don't think people realize that you can do this for things other than looking a certain way. He said, a lot of people that I see do it for migraines. And he said, if that's what they have to do, then let them do it. But, you know, it's not really hard to
story. I'll tell you about a story. My sister has extremely bad TMJ. She also has MS, which gives her a lot of pain and pain syndrome. And she goes to a Max Fac. Like, is that how you say it, Max Fac? A surgeon. And they will go in and they will just inject Botox everywhere, scalp, neck, face. Every single time she goes, she ends up like droopy, lopsided, whatever. Their answer is, oh, we're not here to worry about the way you look. We're just wanting to get rid of the pain. But the problem is my sister looks horrific, because she is, you know, they inject her DOAs in a strange way, and she's lopsided. She can't smile, or, you know, she'll be, you know, heavy on one side and lighter on the other. And, you know, her jaw will be off. One side would be bigger than the other. And I literally looked at her and went, oh my God. And the girl, the poor thing, like, there's a bit of depression there, obviously, because, you know, you're unwell, let alone do you want to look not your best. You've got a husband, you've got a job, you know, you're a photographer, you're out there. She went to my clinics. She said, I need to stop. I'm going to pay you to do this medical procedure. an aesthetic person needs to do this for me because I can't live like this anymore. There's so many things that we do in clinic that people don't even think and stop to think, my gosh, the ramifications, the emotional and physical ramifications of what we do. But yeah, that was a little bit of a side note. You guys have a rally coming up next week.
Yeah.
Oh, wow. I am in awe of you all. Major respect. Tell us how you organize this and what is the protest about? Peaceful protest, guys. Peaceful. Right?
I've never been to a protest in my life. I'm just going to put that out there.
Neither
And
have
I
I.
didn't know if I would ever make one. I didn't know if I'd ever go to one, let alone be one of the organisers of one. But it's very peaceful. It is more that we have actually been writing. Everybody has been writing to their local MPs, and we're not getting any answers. We're not getting any seat at the table. I've said it before, but my local MP is actually the health minister. I'm in his electorate, and I went to his office. He still won't meet with me. He won't answer my emails. He forwards them to somebody else. So it is time to listen to our concerns about this fact sheet, and it's not happening. So we're going to try and make you listen. And at least make other people realise. We did actually have a meeting set up with an MP in Parliament a couple of weeks ago, and they cancelled on advice from the health minister to not meet with us. So we know that we're trying to be silenced for some reason, and we're not really quite sure what the reason is, but we're not going to be silent anymore. We have our banners, we have our shirts, we have our flyers, we have media coming. The media.
We have police approval.
Yes.
Oh, Ree's like, we have police approval.
It is.
No megaphones.
No, we just want to be heard. We want people to realise that this will affect a lot more people than they realise. And when I speak to people and I said, do you get injectables? And some of them are like, yeah, I do. I said, do you have a nurse? And I'm like, yeah. And they're like, oh. I said, that nurse will be also affected by these. So, it is something that will affect more people than they realise.
Wow. I'm so in awe of what you're doing. I think that this is a strong message to the industry to have your voices heard in a respectful, peaceful way. Unite. Let's come together, because it has been a challenge. Even I speak to the other associations, it's just a challenge in our industry to get people to unite under a cause. And every other industry, you look at retail, you've got, 10 to 20,000 members of their association. No one messes with retail. When you see, the Retail Association come on TV, they've got power in numbers. The Hospitality Association, no one messes with Wes. Like, I'm in the same groups as these guys on the Council of Small Business, and they have power because they have numbers. And I think our industry just hasn't had this robust representation from a not-for-profit advocate, government or small business advocate for a long time. We haven't had something. I don't think we ever had a small business and employee advocate and a legislative advocate. We've had the organizations looking after best practice and helping with legislation, but no really strong small business voice. And that's the difference. If all the organizations, the individual practice ones, which are so important, like it is important to have, your industry specific and your specific sector organization. But if we all came together under the biggest small business banner under ABIC, how powerful we could be. And this is right now what you're seeing is change driven by numbers, and we see that in other industries. So we need to get with the program, and you are a huge example of that. What can we see in this protest? What are you going to be saying? Are you chanting? Are you talking, or are you just walking? Like, what's going to happen if we want to come along? What can we expect?
We've got some lovely little slogans and some chants to call out on the day. We're going to, ask Tim to engage, listen to us. Yeah. So,
it's writing to him to get a meeting on the day, but I doubt it will happen.
It would be nice if he came out and said, all right, come on, girls, let's have a chat.
Come on in.
Come on in.
We've actually timed it because Parliament is sitting that day. So right. That's the day we've chosen, Tuesday next week, 8:30 in the morning. So
we'll be there at 7:30. So come on in. The clinics don't open till 10 at least. So just, come on in. We've all moved patients try and get there, because as much as, you know, some people reach out and go, I've got patients. I'm like, yeah, but this is your business. Like, how many patients would you move just for an hour of your time to come and show just what it's going to affect? I mean, people will say bring your family, because they're the ones who will be impacted by what this will do to them. So it is very important for our small business, like you say, small businesses, because it's not just our registration and what we do, but it is our small business and our communities.
Absolutely, absolutely. And some final words, like a message to Queensland nurses out there. What do you want to say to them, and what do you want to say to any ministers that are watching this particular live right now?
For the nurses, I'd like to say that, you know, we're stronger together. So please join our group, help us fight this cause. You know, it's for all of us, it's for our businesses, it's for our families.
And give us regulatory clarity. You know, the ambiguous fact sheets are just causing professional embarrassment. And we seek clarity as professionals.
And I
Let us
suppose
do our job.
that's actually so evident in the fact that
Spot on.
they released one, and then they had to back it up with another one because they realized how badly they had done the first time. So I'm sure there's another one coming.
Oh, there are a
You
few
cannot look this second one and go, man, this still just isn't making sense, guys. Like, you've got to come to your senses and realize that you're not engaging with the industry itself. And it's interesting, and I don't like to get political because it's never been my thing, but the Liberal government is all about, you know, they hated the Labor government because of the fact that Labor government would change policies without consulting with industry, and yet they've just gone and done the exact same thing when they said in their campaign that they would never do that. So they've just gone and proven that they have. So that's political, and it's not my thing, but at the same time, we want to be listened to when we are the industry that you're affecting.
And what we want to say as well through ABIC, and I know that you say this all the time and you reflect this message back, is that we love rules and regulations. We think that they're important. We actually discussed earlier, we looked at the APRA guidelines, and largely like there's nothing there that we disagree with. You know, even the cleaning up of industries is not a bad thing. You know, people that highlight, look, hey, we're doing this not great, let's clean this up. That's actually not a bad thing. We're not against anyone calling out when we're like, hey, we can do this better. And sure, the spotlight has been on our industry has been hard, but it really has forced us to level up, right? And that's okay. Sometimes that's needed, because there has been, you know, advertising practices that maybe weren't in line with the original scope of what we should be doing as medical practitioners, right? So,
and there's still a lot that really need to clean up their act, and we're well aware of that. And it's not just nurses. I want to put that out there. Like, I even look at the doctor clinics in my immediate area, and they still list anti-wrinkle and dermal filler. This is an industry cleanup, not just a targeted nurse cleanup.
That's right. But we're not against that. Like, there's other people out there that would think, oh, you know, why is this scrutiny? Why is this happening? No, it's actually not a bad thing, because it is helping our industry to, you know, behave like medical practitioners. And that is not something that we are against. So anybody out there that's advocating for the cleanup, we're actually okay with that. We're not.
Come on in. I'll show you what we do.
Yeah, come on in.
It's that we do all the time.
And we know that some people, like, you know, if they're not within the safe practices, you know, there are risks associated with it. So we're not taking this lightly, but at the same time, all we're asking for is consultation, fairness, understanding that regardless, we as Australians are a very safe and conservative country. I actually went and did the statistics out there in terms of our incident reports and our safety data, in terms of, you know, where we rank in the world. We're actually one of the safest countries in the world for cosmetic procedures. And that's to do with our culture, and the regulatory bodies actually doing a good job, and the medical practitioners being, you know, quite ethical. We're looking at countries that just are the Wild West, right? And we can see that on all the social media channels. So we're not against that. We just want fair, reasonable, and very clear guidelines so we know what we're doing. So if you want to help us to achieve that, please apply to join on the working group. Probably it will be up could even be up tomorrow, but I would say look on our website, on the ABIC website. On Monday, we'll make an announcement when we're looking for working group members. Please join. Get your sleeves up, because we want you to do some work. We don't just want you to sit there. We want a couple of hours a month of a little bit of work and advocacy. And please join, and please help QANU and the Queensland nurses. And if you're in Queensland, please attend the rally. You have to go. We're right on 8:30. Thank you so much for everything you're doing, ladies. You're commendable. Thank you for everyone that you're watching, and we'll give you an update very shortly.
Thank you.
Thank you, Steph.
Tuesday.
Thank you.
Thank you. Bye, everyone.
Bye.
Bye.